I'm Emily. I'm going to be your MP today. I'm going to start by looking at your face, your hair, your scalp. Everything looks symmetrical. There's no noticeable bumps or lumps or scarring. I'm going to palpate your temporal pulses. Good. And now I'm going to assess your cranial nerves. So can you raise your eyebrows? Can you frown? Can you smile with your teeth? Can you close your eyes tight? And can you puff out your cheeks? Good. Now I'm going to have you close your eyes and tell me when you feel me touching your face.
Yep. Yes. Yep. Yep.
Okay, open your eyes. Did it feel the same on both sides? Now I'm going to palpate your temporal and your masseter muscle by palpating your temporal mandibular joint. So can you clench your jaw a few times? Good. And open and close your mouth. Good. Now I'm going to move on to your eyes. Your eyelashes and your eyebrows will look symmetrical and good. I'm going to take a look at your conjunctiva. So I'm going to put down here. Can you look up, down, left, and right? Good. Now I'm going to assess for EOMs, convergence, and accommodation. So without moving your head, just follow my finger with your eyes. Good. Now I'm going to assess pupillary, look at your pupils. So I'm going to dim the lights. And then I'm just going to have you look straight over my shoulder. And just try not to blink. There we go. So just look straight over. I'm testing for direct and consensual pupillary response. Good. And just keep looking straight. Good. Now I'm going to look at the back structures of your eyes. So same thing, just look right past me and try not to blink. My right. Right. Your right. There's the red eye reflex. The blood vessels look good. As I look medially, I see the disc in the cup. And as I look laterally, I see the fovea and the macula. Good. Now the other side. Just look straight past me. There's the red eye reflex. The blood vessels look good. As I look medially, I see the disc in the cup, and as I look laterally, I see the fovea and the macula. Good. Now we're going to move on to your ears. So I'm going to palpate your ears. They feel symmetrical. That doesn't hurt, right? Good. I'm going to perform the whisper test. So you're just going to repeat after me.
Red, white, blue, dog, cat, mouse.
Good. Now I'm going to perform my otoscopic exam. So I'm going to pull the pinna up, out, and back. I'm going to pin. The TM is pearly gray. The external auditory canal looks good, and there's no cerumen. Other side, same thing, pulling the pinna up, out, and back. TM is pearly gray. And the external auditory canal looks good. Turn the light off. Oh, your ears look good. We're going to move on to your nose. So your nose is midline and symmetrical without any scarring or deviations. I'm going to perform the sniff test. So I'm just going to occlude one side and take a breath in. Good. And the other side, breath in. Good. Now I'm going to look at the inner mucosa and turbinates. So I'm just going to pull this up a little bit. There's no polyps or obstructions. Other side. Good. Now we're going to move on to your tongue. Well, your mouth. Sorry. So I'm just going to have you open up for me. Put your tongue in, open wide. I'm looking at your lips, your teeth, your buccal mucosa, your gums, your tongue, under your tongue. Good. Your posterior pharynx, your uvula, and your hard and soft palate. Everything looks good. Can you stick out your tongue and say ah? Good. And now just the gag reflex. Good. Your mouth looks good. We're going to move on to your neck. So I don't see any visible lumps or bumps. Your neck looks symmetrical. I'm going to palpate your lymph nodes. So your pre-auricular, your post-auricular, your occipital, your submandibular and submental, your posterior cervical chain, your anterior cervical chain, your supraclavicular, and then just shrug your shoulders against mine. Good. Now I'm going to focus on your thyroid. I don't see any noticeable goiters, so I'm going to have you take a sip of this and then hold it in your mouth, and I'll tell you when to swallow. Can you move up a little? Okay, thanks. Do you have it in your mouth? Okay, so put your head down. Oh wait, sorry, let me feel for your Adam's apple first. Okay, and go out. Okay, down and to the right. Roll your head to the right. Good. And I'm pushing the other side. Swallow. Good. And now the other side. Same thing. Okay, down, out, and swallow. Good. Okay. You can back up again a little. Good. Now I'm going to focus on your cardiac system. So if you wouldn't mind moving your your shirt, so I can see your chest. Oh, sorry, I'm going to start with your respiratory system. The skin looks good. There's no bumps or scarring anteriorly or posteriorly. Your AP diameter is 2 to 1. So I'm going to now percuss. Okay, and turn that way. Turn a little bit more. Okay. Good. Now I'm going to have you turn around again. And I'm going to just listen to your lungs. Every time I move my stethoscope, just take a deep breath for me. See if I can see. Okay. Sorry. Here's that. Good. Now, same thing, face that way. A little more. Okay. Deep breath every time I move. One more. Okay, good. You can turn back around. Now I'm going to focus on your cardiac system. I'm going to start by palpating your carotid arteries one at a time. Good. Good. And I'm just going to listen to them with my bell. You're just going to take a deep breath in when I say and hold it. Take a deep breath in. And just hold that. Good. You can let it out. And one more time. Good. Now I'm going to have you lean forward. There are no heaves or pulsations. Good. I'm going to listen to your heart sounds. Turn a little bit so you're facing. Okay. Let me see. Okay. Aortic. Wait. Aortic. Pulmonic. Oh, sorry, you can breathe normal. Herb's point. Tricuspid. And the mitral. Good. Other side. Good. Now I'm going to have you lie down while I listen again. Yeah, lie flat. Okay. Okay. I'm going to listen with both sides again. Good. Good. So while you're lying down, I'm just gonna look at your abdomen. Your abdomen is symmetrical. Get lower. Symmetrical. There's no lumps, bumps, scarring. Everything looks normal. I'm going to auscultate your bowel sounds. Good. Now I'm going to percuss. Sorry. Good. Now I'm going to percuss for the liver border. So I'm going to percuss upward until tympany turns to dullness. Okay, so now I'm going to have you take a deep breath in and then a deep breath out. Good. Now I'm going to palpate the rest of your abdomen. There's no noticeable grimacing or guarding. Good. Now I'm going to go back over here and focus on your peripheral vascular system. So starting at your upper extremities, the skin looks warm, or the skin feels warm, and the skin looks good. and symmetrical. I'm going to palpate your brachial pulses and your radial pulses. Good. And now capillary refill. Good. Good. Now moving down to your legs. That's better. Same thing. The skin feels warm and it looks good and symmetrical. There's no edema along the tibia. Good. So I'm going to feel your femoral pulses. Good. Now I'm going to do your popliteal one at a time. So I'm just going to bend your leg to 30 degrees. Good. The other side. Good. Now I'm going to move on to your dorsal. There we go. Your dorsal pediis. Your posterior tibialis and your dorsal pediis. Good. And capillary refill. Good. Now I'm going to have you sit up again. We'll go back to the chair. Oh, you can put your shirt on if you want. Last couple of parts, we're going to do your neurological system now. So I'm going to have you close your eyes and tell me when and where you feel me touching you. I'm just going to have you kind of relax, open your feet up for me. Good. When and where you feel me touching you.
Left hand, right hand, right foot, left foot.
Good. Now, my hammer, I'm going to assess your deep tendon reflexes. So I'm going to start with your triceps. I'm going to have you just relax so you can see me. Let me start with this one. Yeah. You can turn maybe. Right here. Okay. So I'm going to have you relax. I'm going to find B. Good. Okay. And the other side. Just kind of relax. Good. I'm going to find the V. Okay. Good. And now we'll do your biceps. So again, so you can see. I'm going to curl your arm and look for the medial tendon, the tendon medially. Good. Okay. Okay, the other side. Okay, let's see. Find it medially. Okay. Now we're going to do your brachial radialis. So I'm going to grab here to kind of help you relax. Going to find your distal radial pulse. Go 2 fingers from there. And then with the long side, I'm just going to, okay. And this side, relax. Find your distal radial pulse. 2 fingers from there. And I'm going to tap. Good. Now I'm going to do your popliteal, but before I do that, I want you to grab your hands like this. And when I say 3, you're going to pull as hard as you can. So I'm going to find popliteal. Okay. Ready? 1, 2, 3. Good. And On the other side as hard as you can. 1, 2, 3. Good. Now I'm going to do your Achilles tendon. So I'm going to hold your foot. Let me back up a little. Sorry. Okay. 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 And I feel the dorsiflexion. Good. Now I'm just going to finish with the Babinski. So I'm going to run the bottom of my hammer along your foot. The last part of our exam is going to be the musculoskeletal. So I'm going to have you stand up. I am going to have to raise your shirt for this. So bend over like you're diving into a pool. Good. Your spine is midline and straight. Everything looks symmetrical. Good. Stand up. Now you're going to face me. You're going to put your hands on your hips. You're going to twist to your right. Good. Twist to your left. Good. Now you're going to dip right. You're right. Dip right. And dip left. Good. And that completes our